Hello, everyone, and welcome to our third Boots in the Barn webinar. I am Katie Calero, the Dairy Management Specialist with the Southwest New York Dairy, Livestock, and Field Crops team. Today I have with me Margaret Quasdorf, who is the Dairy Specialist with the Northwest New York Dairy, Livestock, and Field Crops team. And Margaret will be monitoring the chat and helping with any questions and answers that we have. Today, I have the pleasure of introducing Dr. Adam Beard, a postdoctoral associate in Dr. Sabina Mann's lab at the Cornell Vet School. He will be presenting on early calf management, key influencers on heifer development. Go ahead and take it away, Adam. Thank you.
All right, thanks so much, Katie. Start sharing here. How does that look?
Looks great.
Yeah. All right, thanks so much. Thanks for having me. Thanks for the invitation. Thank you for those that are attending and participating today. Thank you to those of you that have boots in the barn every single day. Frankly, I'm glad my boots are in the office today with how chilly it is outside. But yeah, as Katie said, I'm Dr. Adam Beard, and today I'll be talking about early calf management and key influences on heifer development. This is a personal interest of mine as well as our lab in general. So just very briefly about myself, so you kind of have an understanding of my perspective and why I care about why I care about what I care about. I'm originally from Virginia, went to Virginia Tech for undergraduate, did my bachelor's there in animal science, caught the bug for reproductive biology. From there, I ran off to the University of Wisconsin, where I studied bovine reproductive biology, in particular prepubertal endocrinology of calves. And so these are actually images here that I took of 3-month-old um, calf ovaries and their follicles. And I did several experiments there trying to understand um, their endocrinology in this time, this early uh, pre-weaning, immediately post-weaning time, and through puberty, those hormones and whatnot. Learned some pretty shocking things and was very curious about what their early life and how that is contributing to their endocrinology at that time. I found that they're very responsive, just like an adult. They're just missing a few things in their system there. So as I was wrapping up my time at the University of Wisconsin, this opportunity came up at Cornell to study early life calf management in the context of transition milk and cow-calf contact. And so I came over here to Cornell to incorporate my own interests into that project and continue learning there. And I'll share some of that today, as well as some other things that I've learned throughout my academic time. So I like this photo for a couple reasons. One, because it reminds me of warm and sunny July, but the other being that uh, this calf here is essentially perfectly in between prenatal and postnatal life. It's now separated from the dam and the placenta and no longer receiving those influences, but not so postnatal that it's touched the ground. It's, maybe taken its first breath, has had no colostrum, hasn't been licked. So it's at this really naive time where no postnatal influences have really happened yet. And I want to talk today about the perinatal period and the development that happens during that. And so for today's sake, we'll consider the perinatal period being the 2 months prior to birth and the 2 months after. So prenatal development, 2 months in utero, last 2 months of gestation, and then the first 2 months after birth. And there's this developmental plasticity that happens during this time, plasticity being flexibility, things can still change. And that's, pretty well known in utero. There's obviously still development happening. The placenta is transferring nutrients. There's this communication that the dam has with the calf, and the dam stressors become the calf stressors a lot of the time. And so that's pretty well a given. But then we have this postnatal period where it makes you wonder if that maternal influence is still there in postnatal development. And um, nature and by design would say yes, because for mammals that young, that offspring is consuming milk, and that's not only nutrients but a message and communication from the dam for continued development. And of course in the United States dairy industry, this is typically not the case. A sustained relationship with the dam between her and the calf and the milk that's consumed. So, of course, we have several different types of milk that calf is drinking during that 2 month postnatal time period where development is happening, and several different factors. So, what the calf is drinking, how much, is that whole milk, is that waste milk? Um, is it pasteurized? Is it not pasteurized? Milk replacer or transition milk or cow-calf contact in suckling. And so we'll go through several of those today and what maybe some of the implications are for that postnatal development period. So again, developmental plasticity, going back to that topic, uh, this is from Dr. Laporta review that she put together from the University of Wisconsin. And she likes to refer to developmental plasticity as both an opportunity or a risk, which I think is really profound. And so this schematic here is uh, fold increases in weight for different organs from birth to weaning. And you'll see at the top, body weight essentially doubles from birth to weaning. Then she's highlighted a couple other organs here related to the mammary glands, again, about doubles in size. But you get down here to the ovary and the mammary parenchyma, or the functional tissue of the mammary glands, and those have a much larger fold increase in weight that's happening from birth to weaning. And so um, these are some of the organs that stand a chance to have a great opportunity to be developed, but also a great opportunity to be at risk. And so we'll talk about some of those today, but especially that mammary functional tissue, a 25-fold increase in weight between birth to weaning. So really my title should have been Key Maternal Influences on Heifer Development, because I really want to focus on the maternal contributions to that both prenatal and postnatal development through again um, the dam stressors in fetal life that are contributing to the calf, and then as well as colostrum and diet in the pre-weaning period that relates to health and growth of a weaned calf, the repro around the peripubertal time, as well as mammary gland development as they reach a year of age. That brings me to the first study that I had the opportunity to be a part of. This was a pretty minor contribution at the University of Wisconsin. This is again from the Laporta lab, who I was just speaking about. And the title here, in utero heat stress compromises whole body growth and mammary development from post-weaning through puberty. So that gives you an idea of what's happening here. But let's look at the study. This they conducted it on a commercial dairy farm in Florida. So these heifers subsequently were moved to Wisconsin, but the experiment happened in Florida. These dams, the last 2 months of gestation, they were either provided shade, high-speed fans, and soakers as heat abatement strategies, or uh, only shade and natural ventilation, no fans, no soakers. And so uh, these were referred to as then the in utero cooled calves and then the in utero heat stress calves. This got up to about at least a 68 THI, temperature humidity index. Um, and then at the time of birth, all of these calves were managed identically the same by the study team. So some of the things that they ended up finding from this study was that the late gestation heat stress were to cause, at the adult period, a lighter body weight and body length when these heifers then reached a year of age, smaller mammary glands, shorter teats. They had fewer proliferating cells in the mammary glands, and then related to repro in the ovary, they had smaller ovulatory follicles and a smaller CL. So that prenatal development period and developmental plasticity definitely here at work, affecting very important things in the heifer's biology and reproduction and production at this time later in life. Just taking a look at that a little bit further. So once these heifers reached puberty, we ran them through a synchronization protocol, not to breed, just to synchronize for the sake of research and data collection. Here on day zero being about the time of estrus in that synchronization protocol, the the calves that were not heat stressed in utero, again, this was only in utero and nothing postnatal, they had higher estrogen at time of estrus, which is a good thing. Their ovulatory follicles were larger, um, and their CLs were larger than the in utero heat as well. We'll move on to some recent work from Cornell from our lab. This is not something that I had any part of, but I'm excited to share from our lab. This was published late last fall, led by Grace Frederick. So we're moving towards postnatal development now. And so this study, looking at the effects of feeding colostrum volume at 6, 8, 10, or 12% of birth body weight, and looking at the efficiency of IgG absorption, how that GI tract is emptying, as well as the behavior after feeding those different volumes of colostrum. And so some of the rationale behind this is, 4 liters of colostrum, pretty standard, and is often not finished voluntarily by calves, particularly a smaller Holstein heifer calf, which would result in, tube feeding and such. And then also a larger volume of feeding colostrum can slow down the passage through the small intestine and also slow down IgG absorption, as that is the site where that is occurring. So in this study, they had 88 calves. Those calves were fed a single colostrum feeding at either 6, 8, 10, or 12% of their birth body weight. And so these calves were enrolled in a block design, so well controlled. And so they essentially a matching set for 6, 8, 10, and 12. All of these calves were fed by esophageal tube feeder, so it was not left to the calf to voluntarily drink the colostrum. As far as standardizing the colostrum, it was pooled, pasteurized, and frozen before feeding with a minimum colostrum Brix of 20%. So let's have a look at some of the results that they collected here. So this is serum IgG at 24 hours. So they fed that 6, 8, 10, or 12% of birth body weight, came back at 24 hours and took a blood sample to measure serum IgG concentrations. And um, I have a line here that denotes what excellent transfer of passive immunity is, and that is 25 grams per liter of serum IgG by that 24 hours. And so you see here 6% of birth body weight. Not all of those calves achieve that, and that serum IgG concentration is lower than calves that receive 8, 10, or 12%. Looking at the 8 and 10% groups, no difference, as you can see by these letters, no difference, significant difference in their serum IgG concentrations at 24 hours, and 12% is increased from the 8% group. So, yeah. Looking at the efficiency of absorption of that serum IgG, which is calculated by this equation here with birth body weight, a standard serum IgG concentrations, as well as the amount of IgG that was fed based off of colostrum IgG content. And this is the apparent efficiency of absorption. And so the calves that received the least amount of colostrum by birth body weight at 6% had the greatest efficiency of absorption of that, whereas the 12% had the least efficient absorption of IgG. Paired with gastric emptying, so this is a subset of calves that received acetaminophen, which is Tylenol, in their colostrum to be used as a marker for the gut emptying, the Tylenol being absorbed into the bloodstream through the small intestines like IgG would. Um, and so, again, that 6% of birth body weight had a faster absorption of, or excuse me, gastric emptying compared to the 12%, again, showing that the larger volume of colostrum slows down the time of absorption of IgG using acetaminophen as a marker. And then they also looked at behavior 2 hour post-feeding. As you can imagine, a 12% birth body weight feeding could be quite a lot. And so they looked at vocalizations as well as kicks, kind of markers of discomfort and colicky behavior. There's no difference in the number of vocalizations between these groups. But when you look at the time that they kicked, or the frequency of times that they kicked at their abdomen as if they were uncomfortable, that was only occurring in the 10 and 12% groups. So if we look at 8 to 10% birth body weight, I see this as kind of the intermediate optimum where you're making a couple compromises, but maybe coming out with the best outcome here. So compared to the 6% body weight group, the 8 to 10% is seeing an increase in serum IgG concentrations at 24 hours, as well as they're all or mostly all reaching that excellent transfer of passive immunity. And then compared to 12% birth body weight, they are more efficiently absorbing that IgG and faster. A couple notes here is that this was all, good quality colostrum. Um, the study team was involved in feeding this quickly after calving, and there were no long-term effects observed here. So whether feeding 8 to 10% versus 12% had some long-term outcome on health, we can't say from this. So how does this compare to current colostrum feeding practices in New York State? That brings me to the work of Dr. Trent Westhoff, who's a graduate of our lab. This is a massive study that he put together and published in 2023, happening much less frequently. And so that's something that I want to, segue into as we start to talk about cow-calf contact. But first, transition milk. What about it? So the composition of transition milk versus mature milk, we're looking at greater solids, greater protein, greater fat, and that's decreasing as the milk becomes a more mature characteristic. We also know that it's greater in insulin and IGF-1, which are growth factors. So some non-nutritive components for this calf that they can be developing from. As far as pre-weaning body weight, there's been mixed results of if there's an effect of feeding transition milk compared to milk replacers. Some studies say that they have increased body weight gain. Some are saying no effect. But there's more agreement across studies for improved health scores pre-weaning for transition milk versus milk replacer. Some other things related to transition milk. Some studies have found decreased markers of inflammation in that pre-weaning period, particularly haptoglobin. It contributes to mucosal and submucosal development of the GI tract. Again, some postnatal development happening here. And then perhaps increased solid feed intake at weaning, which is desirable. But as far as transition milk versus whole milk feeding, that data is lacking. And so that would be a really important comparison to have. And so that's something that we wanted to seek out in this next study that I'm going to bring up related to delaying cow-calf separation. And so this is a study that I led over the last year and a half, looking at the effects of transition milk feeding with and without cow-calf contact on the health and growth of pre-weaned Holstein and crossbred calves. And so we are interested in the physiologic impacts of transition milk feeding, as well as interested in the um, the societal components of cow-calf contact, if that's something that's feasible and could be implemented, and what challenges might be there. So just briefly here, setting up uh, what we did. So we have this 2 by 2 factorial here of cow-calf contact, yes or no, transition milk, yes or no. So this group here, unrestricted suckling, this calf was with the cow for full time. Never removed it. We didn't feed the calf. The calf suckled directly from the dam. So she was getting transition milk with full social contact with the cow. Now we had a group that had no contact with the dam, but was being fed the dam's transition milk. I'll show you how we did that. Um, and then we had a group that had no social contact with the dam and was also not feeding or being fed the dam's transition milk. It was receiving saleable, unpasteurized bulk tank whole milk. Uh, and then the group of cow-calf contact with no transition milk, that's not something that we tested. It was outside of our scope of what was feasible. We would have had to, wrap the udder somehow to prevent the calf from suckling while having that contact. And that's just not something that we were able to take on for this. So a little bit of the experimental design. This occurred from April to November of 2024. And then we picked back up in March of 2025 and concluded in June. This occurred at a 160 cal freestall teaching dairy using a just-in-time calving approach for their calving pen. Determination of study eligibility occurred at the time of calving. We were using both primiparous and multiparous cows. They needed to not have any kind of aggression at time of calving. This was not an issue. We did not have to exclude for this. And maybe that's partly because of being at a teaching dairy where most of the cows are quite calm already. But on top of that, cows cannot have any kind of oddities as I've called them here. So they must have had 4 lactating quarters, no mastitis at time of calving, no udder or teat injuries, no low hanging udders that would prevent a calf from suckling. On top of that, we at time of enrollment, we collected colostrum from them, and they needed to be able to produce 8% of the calf's birth body weight. And that's because we wanted to ensure that if there was a calf that was with the cow, that the cow would be producing sufficient milk for that calf. And we fed that calf 8% of birth body weight, just like the previous study. And we were aiming for 20% or greater on bricks, though most of them were well above 22% bricks. So we had really great colostrum quality on this study, very timely, monitoring calving and getting these pairs enrolled quickly. We were looking for a vigorous calf, according to the Wisconsin Vigor Scoring System that looks at things like their membrane oxygenation, their heart rate, respiration rate, how quickly they're getting up, how responsive they are. That way we didn't have any super dopey calves that we would expect to suckle from a dam. We used Holstein and crossbred calves and only singletons. Total enrollments from that were 81 pairs. We had 3 different groups, as I talked about. We had an unrestricted suckling group. That calf was with their dam for 5 days, full contact. You'll see this denoted as URS, unrestricted suckling. We ended up with 26 pairs, and 11 of those were replacement heifers. Second group was immediate separation at calving of the cow and the calf, but the calf was fed the dam's transition milk, 27 pairs there. And then immediate separation, and the calf was fed bulk tank whole milk, 28 pairs there. The design continued calf feeding procedures from day 1 to day 4. Uh, we only fed the transition milk and whole milk calves because the other group was suckling directly from the dam. And we fed them 10% of their daily morning body weight in 2 different feedings. So 20% of the daily body weight per day by a nipple bucket. And day 5 to day 7, now all calves are separated from their dam. So those ones that were with them for 5 days have now been separated. They're all moved outside to a secondary site. All calves were fed whole milk, including the transition milk, prior transition milk calves. All calves were fed whole milk at 10% of daily morning body weight in 2 feedings per day. Again, all calves were separated on day 5, and we monitored them for 2 days post-separation. And then replacement heifers, we had 38, and we followed them until just before weaning at about 63 days of age, following their health and growth 1 time per week. So here's a look at our research stall design. So we had 4 pens in this barn. Our host today, Katie, was very involved in making this happen in the infrastructure. So by the time I got here, everything was ready to go, which was great. So we had 4 different stalls. Each of them could be set up to accommodate any pair. So the pairs that were together were not excluded to just this pen here. So there's a calf creep area that the calf had access to, and then there was the cow pen. And the calf had unrestricted access to both this pen and the cow and calf pen if they were together. As you can see here, can go right through this little doggy door in a sense. Um, and the only time that that calf was restricted to the other side was only during the time of milking of the cow. So she wasn't present at milking. Otherwise, again, the cow and calf were separated. There was no visual or physical contact between the cow and the calf on other sides of the wall. Here's another look at it. This is it at full capacity. So again, this is a group that's not together. That door is shut. Like to keep everything nice and clean. Um, and yep, we milked in the stall, head catch here, swung the gate, fed in the stall. All the cows had, high-speed fans and access to fresh water at all times. A couple other photos here. Again, we were milking each cow 2 times per day in their stall and using that transition milk to then feed the calf on the other side of the wall by a nipple bucket from day 0 to day 4. And then day 5 to day 7, we moved those calves outside and we're feeding them there while monitoring. All right, let's look at some of the results from this. So looking at the milk intake, what I have here is the milk intake for all calves as well as the replacement heifers. As on a weight basis or volume basis, you can essentially think of kilograms here as 1-to-1 for liters for the purpose today, as well as a percent of their daily body weight. So kilo divided by kilo to give you a percentage for all calves and replacement heifers. And so we only have data for the transition milk and whole milk calves, of course, for the first 4.5 days, because those are the only ones that we're feeding. And you can see them start to, drink more throughout the day, or excuse me, throughout the 4.5 days. A slight treatment difference between groups here on percent of daily body weight. but not for the replacement heifer, showing that the replacement heifers did drink the same amount of transition milk and whole milk between groups, which is really important for interpreting the results that they consume the same amount. Uh, and then we have the introduction of our unrestricted suckling calves that weren't fed by us until day 5 here. And so you can see on every single one of these graphs, we go to feed that calf on the morning of day 5. We've just separated her from her dam. She may have just consumed a meal, we don't know, and has no appetite or chooses not to drink on that first meal. Then that increases by the second meal after separation and then catches up to her counterparts. Looking at body weight of all the calves, again, I'll show you some data of the Holstein and crossbred calves, as well as just the replacement heifers that we were able to follow. But this here is body weight for all of the calves. Body weight was not different at birth. Um, and then uh, we have a treatment by day interaction that's occurring here for body weight across those 7 days, which you can see here. These unrestricted suckling calves are weighing heavier than their transition milk and whole milk counterparts on those first 5 days. And then it drops off by day 6 and day 7, and they're the same here. What we're seeing, or our interpretation of this, is that these body weights are from morning daily body weight. We come in each morning, weigh them before we feed them. So these transition milk and whole milk calves haven't been fed for 12 hours. These calves that are allowed to suckle their dam, throughout the whole night, we could be weighing them with a full belly right here. Um, but we have no way of knowing their milk consumption during that time. So this is more likely fill rather than gain. As Once they reach a 12-hour feeding interval, they have the same body weight per day. Looking at serum IgG concentrations here, again, 8% of body weight comparative to that other study that I showed with the 4% of body weight. We did 8%. Serum IgG, not different between treatment groups for either the calves or the replacement heifers, though an effective day. Obviously, you can see that serum IgG concentrations are decreasing from day 1. Looking at calf health, again, this is all 81 calves. We found no association of treatment group with the number of fever events or the number of diarrhea events. We characterize fever as greater than 103 degrees Fahrenheit for rectal temperature. So this is just the number of events here, but there was no association between groups. But you can see by day when temperature may have increased the most, and likewise for diarrhea. There was no association between treatment group and number of events, but just looking at the sheer number of diarrhea events happening across all groups on days 2 and 3, we could probably interpret this as some, nutritional scouring or diarrhea that's occurring early in life, which is pretty common. Looking at heifer health, the same outcomes here, number of fever events and diarrhea events. There were no association between treatment groups here either. And you can see the difference in time as these heifers get older, fewer diarrhea events occurring. Looking at growth of the heifers as body weight, withers height, and hip height. Again, we had no effect of treatment on these outcomes. So at day 0, at time of enrollment and birth, they weren't different, and they grew the same during that period up to 9 weeks of age at just before weaning. So no change in no difference in body weight, withers height, or hip height. We also had no difference in average daily gain for either of these measurements. We also measured some solid feed intake just before weaning, and there was no difference in that either. So some considerations for cow-calf contact, and as far as calf health and growth and heifer health and growth, um, we don't have any results that are remarkably different between the transition milk and whole milk or transition milk with cow-calf contact. And again, we had really great colostrum. We had really great control and monitoring over the calving process to get these calves started really well. So that definitely plays a part. Our hypothesis was that uh, some of these things would be different for the calves that were consuming transition milk. But these outcomes also weren't any worse for having um, the calf in the environment of the cow, which some people might suspect that that would um, put them more vulnerable to health challenges. Some other things here, we studied several things on this project, and we're excited to be able to share a lot of these in the future. I've used some teasers here. Um, As far as human and animal safety, we had no issues with um, any stepping on calves, no injuries to calves otherwise, no behavior-related incidents with humans and injuries. If anything, a gate here or there, and then or a fresh heifer that is reluctant to be milked. Cow and calf behavior, that analysis has not been started yet, but that will be coming. That will be of interest. Transition cow health, that is also on the way. Milk production and other health. We see a reduction in milk yield only while the calf is on the cow. After that calf is separated, that milk yield rebounds in the first 24 hours after separation. And as far as we can see through the first 10 weeks or so of lactation, that's maintained. And other health, we looked at intramammary infection rates. We saw more cures in the suckled group, the unrestricted suckling group. So cows that had a calf on them more cured of infections that were present at calving. Milk quality, we'll be getting to that, as well as the cow and calf microbiome, and again, more contributions to postnatal development. That brings me to just one last thing here. This is a paper that is recently available, a small review paper in JDS Communications that I wrote, related to my interest in heifer reproduction and their early life management and diet. So it's titled here, From Milk to Maturity, the Potential for Lactocrine Programming of Heifer Reproduction. And that term lactocrine is borrowed from this idea in swine biology that was found where calves that were, or excuse me, not calves, baby pigs that were allowed to suckle colostrum had normal postnatal development of their uterine glands, whereas pigs that did not suckle colostrum or weren't allowed to, they had no postnatal uterine gland development. And then that eventually got tied back to this hormone called relaxin that had several knockouts with pigs and with mice, and found that this lactocrine null environment essentially in early life is causing these poor reproductive outcomes. So it has me thinking, what about the lactocrine hypothesis in the bovine? And you do a literature search of this, and lactocrine and bovine are nowhere together, which I find to be really interesting and frustrating and disappointing all at the same time. But that's something that I wanted to contribute to, and what this study contributes to as well. And there's really No mention of relaxin as well. No data for this lactogen hypothesis in the bovine. So I had to resort to other things that I know about um, hormonal concentrations of the milk in the early postpartum dam, and what could be contributing to reproductive development of these calves during this time. So this is a little model that I made. Again, many of our cows, or excuse me, our calves are being fed milk from a bulk tank or non-saleable milk um, from herd cows. So pooled milk, all stages of pregnancy or cycling. And these pregnant cows, they're producing progesterone, estrogen, that is present in their milk, compared to a fresh cow where progesterone is lacking in that anovular state. She's not cycling. So, this progesterone that these calves are possibly coming into contact with, being fed a whole milk diet, is not native, essentially, in the early postpartum dam, which could be having implications on their ovarian development, their neuroendocrine programming in this 2 months, and developmental plasticity. And what could be what could that be driving as far as certain hormones, puberty, the ovary and antral follicle counts. And again, we have a myriad of diets that we're feeding calves at this time. Some kind of whole milk or waste milk, um, possibly transition milk, milk replacer. And what is known about that? Not much, as far as reproductive outcomes from the diet at this time. And so there's a few studies that I was able to find conducted in Israeli Holstein heifers comparing whole milk to milk replacer fed for 50 to 60 days. This is from a couple different studies. They found earlier age at first AI and first calving for calves fed whole milk, no difference in age at first conception, earlier age at puberty for whole milk compared to milk replacer, and no effect of body weight at puberty. Then comparing milk replacer to maternal milk, so calves that were allowed to suckle 3 times per day for 6 weeks. It's no longer transition milk necessarily as it's becoming more mature, so I'm calling it maternal milk here. Um, Maternal milk, those calves had younger age at first conception, younger at first calving, and conception rate and body weight at conception tended to be higher for those calves. A note here, the quality of the milk replacer wasn't really well described, so hard to really infer there. But what we need is more data related to whole milk versus milk replacer versus maternal milk that is happening on the same farm. Of course, that's really hard to find in um, farm data now, as you're unlikely to find 3 different management approaches happening on the same farm with the same repro management. So hard to infer from the data that exists, but we need this. So going back to the idea of developmental plasticity as an opportunity or a risk, thinking back to those diets that I just showed you, there's not enough data to classify any of these as a risk per se to reproduction, as we just don't have that data. But I do certainly see some opportunities here. And so, an opportunity to optimize heifer reproductive development once we learn some of these things by implementing changes to that early life management, or not changing the actual pre-weaning system and what diet they're consuming, but being able to redefine what those milestones are for how that heifer is raised, and possibly repro protocols that are more specific to that system to accommodate them. Um, and lastly, just one opportunity that I see, this is data that I collected while at Wisconsin for my PhD. There's this hormone called AMH, anti-Müllerian hormone, and it's kind of this fad hormone right now where we look to it to solve everything, including in human reproduction. It's produced by the ovarian follicles. It's produced in young calves or by young calves, associated with some fertility outcomes, possibly in adulthood, some supraovulatory response. In adult cows, it's considered not a dynamic hormone, meaning, compared to the estrous cycle where estradiol is changing so often, progesterone is changing. AMH in adult cows is pretty stable, not changing really from day to day or cycle to cycle, month to month. So I studied that in young calves, and to our surprise, we found this massive surge in AMH that's happening in the first 90 days in these calves. No idea why. Only for these calves to then level out at concentrations that we would suspect of an adult. So had we never measured this, um, these adult concentrations, we would never have suspected this happening in. Um, this hormone is produced kind of in a delay where um, these follicles are activated on the ovary and then they produce this hormone over the next 70 or so days. So any follicles that are producing or contributing to all of this AMH at this time were actually probably activated around the peripartal period, whether that be early prenatal or postnatal. No idea. One idea I have is that could this possibly be from early life management in the diet that the calves are receiving? And could this be an opportunity to change that management to change what's happening here for outcomes out here at adulthood? Is a calf that's high here also higher among her peers out here and such? And so, one thing that we can use from our study of unrestricted suckling of transition milk and transition milk feeding versus whole milk, transition milk is higher in insulin and IGF-1, which um, is very relevant in the follicle biology that's happening at this time, which could be contributing to these surges in the hormones that are happening. So that's still to come. We don't have that data produced from this project as the heifers are still nearing 1 year of age. Um, but yeah, look forward to see what comes of that in terms of lactocrine hypothesis and postnatal development of these calves. And with that, a few acknowledgments here. Dr. Sabina Mann leading our lab, as well as my right and left hands on these projects, Grace and Rachel, are funding, as well as several uh, people that have supported us at the farm. And with that, I'll take questions.
Thank you. Sorry, my computer froze there for a bit. Thank you for your presentation, Adam. It was really wonderful, and it was great to kind of hear more about the work that you've done. I'm going to pass it over to Margaret to go for our questions today.
Okay. Sounds good. We have one question in the Q&A, Adam. So I'm going to read it for you, and if you can see it too, maybe you want to read it along. Do you think that a calf having contact with a dam would change her resilience to heat stress? Do you think that being near the body heat of the cow would make it worse, or perhaps better with access to unlimited milk?
Hmm. Yeah, that's interesting. Yeah, I didn't show here. I have some data of actual temperatures across those first 7 days. And I'll preface that our barn was relatively comfortable, out of the winds, not too cold, and especially with the body heat of all the animals in the barn. So um, there were some slight changes in temperature in that time. And if I remember correctly, the suckled calves were just slightly higher. And could that be from the extra nutrition that the calf is getting from the dam, or again, being closer to the dam for a period of time? Um, is there something in the transition milk that's contributing to their thermoregulation. I'm not exactly sure as far as long term, but certainly, if it was a little bit colder in the barn on a specific day, you might see the cow and calf, cuddling up a little bit more for the calf to stay warm. As far as heat stress itself, I'm not entirely sure. I could take a deeper look into that and try to find that information for you if you want to reach out at my email. But yeah,
Thanks for that. Yeah, it's hard to infer when we don't have studies on that in particular yet. Okay. So I'm not sure about your nutrition background. There's a question in here that says ideal milk replacer composition and daily diet. I know for me, as a nutritionist, this is going to depend on a lot of different factors, but I don't know if you want to take a stab at this or that's a question that we can.
yeah, I would probably not be the best to offer that advice, frankly. Yeah.
Okay, that's fair. That's fair. Um, okay. We have a comment in here that says this is incredible research and thank you for sharing. I also agree, like especially that stuff right at the end. That's a real
It's a
brain
brain scratcher.
scratcher.
Yeah.
Yeah. Oh my
Yeah.
gosh, same. Okay, so yeah, it's very exciting stuff coming up that is making us all think. I'm going to ask one of my questions
Please
next.
do.
So my question is, when is transmission transition milk, when does that change out of transition milk? What's the biomarker for that? Or
Yeah. So,
what is the signal or is it based on days?
yeah. So typically by, day 4, day 5 is when the cow is reaching its more mature characteristic of milk, where those things like solids, protein, and fat are decreasing from colostrum into a more mature characteristic of whole milk. So typically by day 5 in lactation, um, the mature characteristic would be there, and it's kind of why we chose day or 5 days of contact to really take advantage of the transition milk period, and why this approach might be a popular first step in people choosing to do cow-calf contact of taking advantage of transition milk for those 4 to 5 days and then separating.
Thank you for that.
Yeah.
Next
But
question. Oh,
I
go
would
ahead.
say that's also there was a time where I had mentioned maternal milk versus transition milk. So um, outside of transition milk, once it reaches its full characteristic, mature characteristic of whole milk, there's still the maternal components that a calf could be drinking, hormones related to the lactocrine hypothesis, beyond the transition milk, but still the synchronous maternal milk that, say, a 30-day-old calf is drinking from a cow that's 30 days in milk, if that makes sense.
Thank you for that. Okay, so somebody says the difference in calf weight due to fill in URS is striking. What did that extra milk those calves were getting go? Where did that extra milk those calves were getting go if it was not realized in growth? And what does that mean for feeding at higher percentages of body weight? Is there some waste that is getting through the system, as in the calves are not absorbing it?
Um, I don't know if we can necessarily say that. I think it could be even just timing of feeding. We don't know that those calves were drinking any different amount of milk. It could just be that fill. That milk could have come right before we weighed the calf, but that calf still be drinking the same amount of milk as the milk that we were offering to the fed calves, right? So that could have been multiple small meals that that calf is drinking over the 24-hour period between when we're weighing her, um, versus the 12-hour intervals of the calf. So again, we don't have a measure of how much those calves are drinking. I really like the idea that you have here, from the question, but I don't think we can even say that they're consuming different amounts of milk. It could just be coming down to the timing that we're picking up the fill.
Thank you. Some farms are using colostrum replacer to mimic transition milk. Can you comment on that practice for the farms that may have difficulty managing true transition milk feeding and can't really do the cow-calf contact yet?
Yeah. Um, I'd say I haven't dug into that a whole lot. Um, I've seen, you know, balancing whole milk or supplementing with the colostrum replacer. Um, that's not something that I can really give a good recommendation on right now. But if again, please reach out to me by email and I can um, give you a better idea. Yeah.
Sounds good. Okay. What do you think about using milk replacer directly after colostrum?
Milk replacer directly after colostrum.
I mean, it's a common practice on
Yeah.
farms. Yeah.
In my experience in studies, I haven't come across that concern per se. I'm not sure yeah, I don't have
Ah,
any thoughts there really.
okay. I have another question myself from some of the earlier research that you mentioned at Wisconsin that you
Yeah.
did. Um, what constitutes late gestational heat stress? Like when I understand from the study what it was, but is there like a certain point that you say, okay, this calf has experienced late gestational heat stress?
Yeah. Most of the time that's tied to the last 2 months, or at least from studies. I think a component of that is also the dry period, and now that dry gestating cow is housed in possibly, obviously different conditions that, may not be given the heat abatement that a lactating cow might. So it tends to maybe coincide with the dry period too. If the cows go out on a dry lot versus the lactating cows in the shade with soakers and fans, that kind of thing. But again, that critical period in late gestation where a lot of skeletal development is happening and just size in general, contributing to smaller calves during late gestation heat stress those last 2 months.
Okay, so you wouldn't necessarily, so like we call heat stress for cows if it hits that certain THI level, is that the same um in dry cows as it is in lactating cows? Or
Yeah, I mean, reaching that, you know, 69 in the 70s, 80s THI uh, for heat stress.
okay.
Yeah.
And then so I used to be a herd manager myself. And so if I knew this is just a scenario I'm thinking up right now. So if
Yeah.
I knew that I had cows that experienced heat stress, you know, it was really hot in the barn, 80 degrees, 90 degrees, whatever, for a certain amount of time in that dry period, 2 months, 2 months before calving. Should I be extra concerned or mark the calves coming out of those cows as late gestational heat stress calves for management purposes? And might that inform you know, if I had to do some voluntary culling, if I'm reducing calves, if I need to sell some calves, or if I'm making X's on, oh, this one had pneumonia now. Oh, she was also a late stress or a late gestational heat stress calf. Is that something that we should be keeping track of in our records at this time?
I mean, maybe, it exists on a spectrum of severity and whatnot. And, um, the length of the heat stress that occurred, are we talking just a couple of days or, 2 weeks, a month, 60 days that this occurred? I think if anything, you might see the seasonal effect of when calves were born and likely to have heat stress each year. And that might pop up in your records, and maybe that's something that you want to look out for. Um, I don't know that you would really mark a calf as heat stressed and then um, make decisions based off of that because um, how do we determine the severity of it? What was actually, the outcome of the heat stress to her production and her potential? But you could maybe look at season if you wanted to make, um, you know, decisions.
All right. Thank you. Um, I think that's it.
And again, sorry for those questions that I can't give a great expert recommendation on at the moment, but feel free to reach out and I can either put you in contact with the right person or get that information and get it to you. I just don't want to give you the wrong advice here.
yes, that you can see the your email address is at the bottom of the page here, so people can reach out to you and email you and follow up with you a little bit later if they have questions with more details. There's one last question here. Can you add transmission transition milk to milk replacer and have the same results? Now, I don't recall exactly the same results that we're talking about. Maybe you remember, but adding transmission transition milk to milk
Transition.
replacer, can it act
Uh,
more
that's
similarly?
that's a very interesting question. I, it's hard to say yes or no without having the data. I don't know if that's out there. Um, you know, to be feeding transition milk and then transition milk plus something, I would just make the assumption that with the transition milk still being there, you're going to get, some of the benefits. But um, maybe the question is um, whole milk in milk replacer, or whole milk in colostrum replacer. But as far as adding milk replacer to transition milk, I don't know much about that practice if it's happening or what you would get from it on top of transition milk that already has, a great nutrient profile. Um, Unless the idea is to stretch your stores of the transition milk that you're feeding. Um,
All right. Yeah, I would just add in one thing. We want to be careful mixing our different sources of milk and making sure that we are checking our solids before we're feeding it to calves too, because maybe we're trying to accomplish one thing by either stretching a little bit our stores, or we're trying to incorporate some of the goodness of one type of
yeah,
liquid feed to another, and we can accidentally ignore the fact that the calves like consistency
yeah,
and their little stomachs, their little guts really like consistency. And there are milk composition diet calculators that can help do those solids and nutrition calculations. And thank you, Megan, for tossing that in the Q&A for us to read there. Um,
yeah.
but that's something that you want to be careful about because you don't want to give nutritional scours to anybody because that's not going to help absorption or growth or anything. So I think with that, thank you again so much, Adam, for your
Y'all,
presentation, for your new research coming out. We can't wait to see what's next.
yeah, stay tuned.
Yes, and I just want to quickly remind everybody that we have been recording these webinars and we will be posting them to the ProDairy YouTube page. These will be available the week after. I believe Margaret put in the chat earlier last week's presentation. And then just a reminder, we will see everyone next week for Matthias's talk about evidence-based development of best cattle management practices. So thank you everyone for coming out today, and thank you again, Adam, and we'll see everyone next week.